Hi, my name is Dr. David Altszuler, and today I'm going to be talking about some frequently asked questions about wearable devices. As a cardiologist, I very frequently have people with various kinds of mainly heart rate monitors asking how exactly to interpret the data. And so thankfully over the last several years we've had really an explosion in the both amount and the detail of the data that we have access to with wearable devices. And the most frequent things that people are concerned about are, what do I do with this heart rate that I see? And so it's important to remember that everyone is wired differently, and your resting heart rate is different than your heart rate when you're exercising. Even small amounts of exercise will normally increase your heart rate. The degree to which you're kind of physically trained will help to dictate what kind of a rise in the heart rate you expect. In general, when you're exercising, you want to pay attention to your symptoms and yourself much more than any numbers you see on the screen. A rough guide is to use the number 220, subtract that from your age, and that's really the maximum heart rate that you should see at any point. For example, if you're 50 years old, the number 220 minus 50, 170 beats per minute. And so if you get to that level and you feel okay, that's fine. You really shouldn't try to push things beyond that. But if you see your heart rate is sustained at 170, or if it gets above that, or if you see that with very minimal activity, your heart rate jumps up near your maximum heart rate based on what your age is, could be the sign of an arrhythmia or an irregular heart rhythm, and that's something that you're going to want to address with your physician. Certainly, if you see the heart rate drifting too low, and kind of a rough guide for a normal resting heart rate is anywhere from 60 to 100 beats per minute, but it's important to remember that people that are very well-trained athletes can normally have a resting heart rate in the 50s. As long as you're not feeling dizzy or lightheaded or feel the inability to really do your normal day-to-day activities, having a resting heart rate a little bit lower than that number of 60 beats per minute is okay. Again, the thing to really focus on what your symptoms, if any, you're having. In addition, a lot of the newer devices are allowing us to actually transmit either a 1 or 2 lead ECG. These are actually quite accurate. They've really only been validated to say whether or not you're having a specific kind of irregular rhythm called atrial fibrillation, or if you have a normal rhythm. You have to keep in mind these are not full, what we call 12 lead ECGs, and so the rhythm analysis is a bit limited, but it's certainly something that people have been paying attention to, and we've actually picked up a number of different arrhythmias. And so these are pieces of information to pay attention to that you can save and certainly show your physician if there are any concerns.